A mammogram is an X-ray. It's a picture of the breast, and it's done in usually two projections, and the breast is positioned between two plastic plates, and the plates are pressed against one another to spread the breast out, and it's a momentary discomfort, if that at all. The plates are then released, and the breast is then positioned in the opposite position. They're done top to bottom and side to side. Digital mammography is like a digital camera. The images are acquired almost instantaneously, and you can review it on the spot. And there are tools to enhance the image, just like there are with a digital picture. There are two types of mammograms that we perform. One is screening and the other is diagnostic. Most women present for screening mammograms, which are routine and patients don't report any problems. Diagnostic mammograms are reserved for those problem-oriented patients. Either they have a personal history of breast cancer, they feel a lump, they have focal pain. Those are diagnostic mammograms, and special views are done at the time of that exam, whereas a screening mammogram, we do routine views on each side. We also perform at Miami Valley Hospital breast ultrasound, which uses sound waves, and it's not radiation, and it's a complementary exam in addition to the mammogram, because it sees some things that mammograms sometimes don't see, and it can also help analyze lumps as to whether they're solid versus whether they're fluid-filled. We also at Miami Valley Hospital do breast MRI, which also does not utilize radiation, but uses magnetism. We ask the patients to come and expect to be here for about 1 hour, and that involves registration, an intake questionnaire, and the actual pictures and positioning of the breast only takes a couple of minutes. But from start to finish, we'd like to have patients expect it'll be a 1 hour block of time. Screening mammography should commence when the patient is 40. If she has a history in herself of breast cancer, or one of her sisters or her mother had breast cancer, then that should be discussed with her physician as to when she should actually start. Many times it's before the age of 40 if the patient does have a sister and or a mother who's had breast cancer. Our goal is to detect breast cancer before either the patient or her clinician palpates it or feels it, when it is extremely small, so potentially it is curable. Here at Miami Valley Hospital, we pride ourselves in our results. Screening mammograms, patients should receive a letter within 10 days. All diagnostic mammograms or problem-solving mammograms, patients are informed of the results at the time that she has the exam. She will also get a follow-up letter.